Hello, this is Dr. Russel Sher. I'm on the board of the North Carolina Integrative Medical Society, and I'd like to invite you to our annual conference that is being held in Asheville at the Crown Plaza and Resort on the 15th and 16th of June. It's a wonderful opportunity to upgrade your clinical skills as well as rub shoulders with your colleagues. Today I'd like to introduce you to one of the featured speakers, Dr. Patrick Hanaway, who is an accomplished speaker and a clinician in the fields of integrative and functional medicine. Patrick is one of the featured speakers who I have known for many years, and I've always been impressed with your ability to see things in a unique way and gather rather valuable information from what you see. So I'd like you to take a few minutes and talk about what you'll be speaking about at the conference.
Great. Thanks so much, Russell. I really am deeply appreciative, having been practicing functional integrative medicine here in North Carolina for 22 years and seeing the growth of what you've done. It's really key for helping us as practitioners. So what I'm going to be talking about is the area of the microbiome. I began to really learn about it in earnest in my own personal experience, having gotten a pretty severe parasite infection in Nepal and India now 27 years ago. And how do I work with it? I ended up finding a lab. I lived in New Mexico and found this lab, Great Smokies Diagnostic Lab, that helped me to find what was going on in the 6 different parasites that I had. And somehow that was my journey into learning more about the gut and the microbiome. And since then, I've learned quite a bit, from you and our other colleagues and the naturopaths, who really formed the basis of my understanding. So then bringing that forward, how do we look at and understand where practitioners like you and I have been really working clinically with the microbiome for 25 or 30 years? And while it's the latest, greatest new thing, we actually know what to do about it. So the talk is going to focus on some of the latest research, which is quite amazing in what's coming forth, and that is our understanding not only of the relationship that our microbiome can change. It can change from the food that we eat. It can change from the exercise that we do, independent of the food that we eat. It can change from the emotions and feelings and stressors that we have. It can change from our experience of going out into the natural world. Whether we live in a city next to a park, in a city next to open space, our microbiome changes. So we'll be talking about all of those aspects and how the microbiome of the world has changed and the microbiome inside us has changed. It's been stated that the microbiome, the human gut microbiome, is the most complex ecosystem ever seen, ever understood. There's so much more that we have to do, and the systems relationships that we have will determine our health and well-being. It is the single biomarker that we can look at to say, how's your health, how's your nutrition?
That's great. And I want to cover some of the aspects of the expertise behind where you've come from. We worked together a long time ago. Probably I've known you for about 20 years, and you've gone on to achieve great things. You have been a past director of medical education for IFM, and you are core faculty at the Institute for Functional Medicine. Mm-hmm. Then you went to Cleveland Clinic, where you're currently research director. Mm-hmm. And tell me, how has that provided you with the insights that you have today?
Well, there's several aspects, one of which has to do with being able to deepen my understanding as an educator by being a clinician. We know there's the theory and there's the practice, and as a practitioner, it's humbling because you have these ideas, then you see what actually works in practice. But it's also, it's astonishing because it's like, wow, I had no idea that food could do that, or I had no idea that just helping to support someone on their journey would make such a big shift in their life. So it really is about taking the ideas and applying them in practice. So that's been really the wonder of what my career has been, both in research and in education and as a clinician. The research side of things now at the Cleveland Clinic, where my role is focused, not only are we doing randomized controlled trials, comparing standard of care versus standard of care plus functional medicine. But we're also looking at value-based care, where we're measuring what are the outcomes of patients and how do the outcomes through our systems-based approach and group-based approaches differ from the standard of care. And not only are we measuring outcomes, but we're also measuring cost. So over the next year, we'll be coming forth with publications that demonstrate the improvements in outcomes and the decreases in cost when we take a systems-based approach. So that's pretty cool, because that's something that's going to change the dial.
Well, if you're interested in coming to the conference, please click on the button below, and we look forward to seeing you there.